Well, hi, I'm Dr. Hagmeyer, and in today's video, we're going to dive into a topic that I think is often overlooked in traditional medicine, conventional medicine, but I believe it plays a huge role in explaining why so many people suffer with chronic fatigue, brain fog, and often autoimmune flare-ups. Today, I'm talking about the reactivation of Epstein Barr. Now, if you've ever been struggling with this relentless fatigue, despite sleeping well, if your blood work comes back so-called normal, but you're really feeling anything but, or if you've had mono in the past and never quite felt the same afterwards, today's video may provide a missing piece to what you've been searching for. Well, let's start with the basics of Epstein Barr, or EBV. This is a part of the herpes family. You've probably heard this as mononucleosis, or just simply mono, or you may have heard this as just kissing disease. Most people are exposed to Epstein Barr virus at some point in their life, and by some estimates, as much as 90% of people, adults, carry this. Now, in many cases, the initial infection just passes and the virus becomes dormant in your body, especially in your B cells, which again are part of your immune system. But here's the key. Epstein Barr virus never fully leaves your body. It simply just goes into an inactive state. So while Epstein Barr virus can remain dormant really for years, certain stressors or triggers can cause it to wake up and then become reactive. And when that happens, your immune system has to mount a response. This often looks and feels like chronic fatigue, autoimmune flare-ups, and some people muscle aches and joint pain and brain fog, and sometimes even low-grade fever or even swollen lymph nodes. Unfortunately, most standard lab work does not check for Epstein Barr virus or even reactivation unless specifically requested. And many doctors, to be honest, don't even think about testing it for patients that present with persistent chronic fatigue or vague symptoms. So let's take a closer look at some of these symptoms, right? You may be dealing with reactivated Epstein Barr if you experience persistent or crushing fatigue that doesn't improve with rest. Like I mentioned, a sore throat or swollen glands without necessary infection, muscle or joint pain or brain fog and memory problems, maybe poor exercise tolerance, maybe changes in mood and energy, hypersensitivity to stress, and frequent viral infections or slow recovery from an illness. And for some people, the autoimmune flare-up continues to happen. Well, studies have shown a strong correlation between chronic fatigue syndrome and reactivated Epstein Barr virus. In fact, many patients that get diagnosed with chronic fatigue syndrome, they actually have high levels of EBV viral load or early antigen bodies or other immune system markers suggesting that this has been reactivated. Now, when Epstein Barr virus is reactivated, it really just creates immune chaos. Your body becomes stuck in this low-grade chronic inflammatory state, constantly using energy to fight a virus that never fully goes away. The immune activation is exhausting and even causes mitochondrial dysfunction, meaning your cells just can't produce energy as effectively, and that directly leads to this unrelenting fatigue. All right, so what causes this virus to become awake again or reactivated? Well, there are several known triggers: chronic stress, both emotional and physical, poor sleep or disrupted circadian rhythms, hormonal imbalances, especially thyroid and adrenal dysfunction, gut dysbiosis, leaky gut, chronic infections like Candida or SIBO, sometimes heavy metal overload, overtraining, meaning you're just doing too much, you're not allowing your body to recover. This can suppress the immune system. Certain medications will certainly do this. In other words, when your immune system is just overwhelmed, it becomes weakened, and this is when Epstein Barr virus can resurface. All right, so what do you do if Epstein Barr virus has been reactivated? Well, this again is where functional medicine really shines. Instead of just chasing the symptoms of fatigue, we really want to try to focus on restoring immune balance. We want to support the detoxification pathways. We want to address root causes of immune dysfunction, and we want to support mitochondrial issues. Here are some key strategies that I want to share with you. Number one is we want to calm the immune system down. We want to support, again, the adrenals with things like adaptogens and ashwagandha and rhodiola or holy basil. We want to consider things like licorice root or cat's claw. We want to use maybe some natural antivirals to suppress the Epstein Barr virus. We want to reduce chronic inflammation with curcumin, resveratrol, fatty acids. Number two is we want to heal the gut. Your gut houses 70% of your immune system. So repairing things like a leaky gut, using things like probiotics and glutamine and zinc carnosine, following a anti-inflammatory diet. Number 3, we want to support mitochondrial function. Mitochondria are those cellular energy factories, and they take a major hit with Epstein Barr. Things like CoQ10, L-carnitine, alpha-lipoic acid, B vitamins, all again to help restore energy production. We want to optimize sleep. We want to prioritize restorative sleep. We want to aim for 7 to 9 hours. Nightly breath work, meditation, gentle movement, all things to downregulate nerve system activity and shift out of this fight or flight into more healing part of the nerve system. All right, so the next thing we want to do is we want to identify any triggers. These things might be mold, might be things like heavy metals, might be past Lyme disease or other co-infections for autoimmune disease. And again, if you're not improving, your health history warrants further investigation. This is where personalized testing and working with a functional medicine doctor will uncover some of these hidden blocks to healing. All right, just some final thoughts I have here. So again, reactivated Epstein-Barr virus, this is a real situation. And for many people, it's the invisible virus that is driving their fatigue, driving chronic inflammation, driving chronic immune system dysfunction. I see this so often in my patients. And so if you're struggling with unexplained symptoms and feeling like you're just hitting a wall with traditional conventional medicine, I don't want you to overlook the possibility of chronic Epstein-Barr virus or that reactivation. And the good news is that when you support your immune system, you address your body's terrain, and you remove these stressors, your body can regain control and push this Epstein-Barr virus back into remission. If you're ready to uncover whether Epstein-Barr virus is affecting your health, reach out. We work with patients all over the world to identify their root causes of fatigue and then create a personalized treatment plan that brings back relief. I want to thank you for watching. See you in the next video.